Firstly, we look at abnormal liver biopsy. There are no normal liver cells seen, such as hepatocytes, in this photomicrograph. It is mostly dysplastic glandular cells, which are hyperchromatic and pleomorphic. The variation in size between the nuclei can be clearly seen. So here we have relatively small nuclear size, and here compared to much larger nuclear size here. Next, we look at a photomicrograph of abnormal breast tissue. You can see irregular lobular architecture. So you would normally expect to see just double layers, but they're starting to lose their architecture. There's dense fibrous tissue. Lymphocytes and fibroblasts can be seen. So the lymphocytes here, which are the body's way of fighting abnormal cells, and fibroblasts down here, which have a slightly different shape. They're more elongated. Now we see normal liver core biopsy. What we see are lots of tightly packed hepatocytes, which is what you would expect to see in a liver biopsy from a patient that's not showing any disease. And the area here that's sort of seen as a clearing, this is the terminal hepatic venule. Lastly, we move on to normal breast tissue. This is a mammary lobule. So EF here represents extralobular fibrocollagenous tissue. The IF here is intralobular fibrocollagenous tissue. And then down at the bottom here, with the arrows, are terminal ductules, and they are identical to the intralobular terminal duct seen here. Histology of the breast can be loosely divided into ductal systems: terminal ductal lobule units, TDLU, and surrounding stroma. The TDLU are the functional units of the outer layer on basement membrane. It separates the ducts from stroma. These images were taken from Westminster Slide Box and Human Histology by A. Stevens, 3rd edition.